And we're recording, so let's go back to the PowerPoint. Now we're going to talk about surface anatomy. Anatomical position is hands at side, palms forward, feet together. Supine as you're lying on your back, prone you're lying face down. Okay, you guys should know, students should know all of these terms. All of these terms. The first assignment has many questions in WebAssign, and it asks you to use these terms to denote the chin, the mouth, the cranium, and so on. Digits of fingers, palm. So this is anatomical position. This is the view from the rear. So we're going to have anatomical regions. So what does that mean? We'll have quadrants. During medical observations and medical procedures, locations of incisions need to be stated in the medical record, and these quadrants will be one way to indicate what happened where. I had surgery on January 6th. I had an incision about right here to go into my heart and to put a window in to remove fluid. Then we can further divide parts of the abdomen and pelvic region into the hypochondriac region. It's on top of the ribs. Epigastric is above the stomach. The umbilical region, right of the lumbar vertebrae, left of the lumbar vertebrae on the left side. The inguinal region, the hypogastric under the stomach. So you'll have questions to complete on these regions and on the quadrants. This indicates where the lungs are, where the heart are located, where the stomach is located, and so on. So your nose is anterior to your chin. Your chin is inferior to your nose. Your hand is lateral to the midsection of the body. So we'll give examples of all of these terms. So medial, lateral, proximal means closer to the midline, distal means farther away, cranial, caudal, your back, your anterior section, your posterior section. So suppose you have a wound on your back. That's the dorsal or posterior region of the upper body. So how do we slice and dice here? Transverse section, sagittal, mid-sagittal, frontal plane. So if Jason of the Chainsaw Massacre cuts you down the sagittal plane, your left side and your right side will fall and be separated. If he cuts you down the frontal plane, your posterior and anterior will be separated. If he cuts the transverse section, you'll have the superior versus the inferior, superior versus the inferior. So these are called planes, and it indicate how the body can be sectioned based upon the location of the plane. What are the body cavities? The ventral body cavity protects organs, permits growth and movement, and surrounds these various systems. So know what's in the abdominal pelvic cavity, the thoracic cavity, and overall, these thoracic and abdominal make up the ventral body cavity. This is anatomical position. So your back or posterior, your front, ventral or anterior. Pleural cavities with the lungs, pericardial cavity with the heart, peritoneal cavity with the guts, abdominal cavity also with your intestines and large intestines and small, and the pelvic cavity with the urinary bladder, for instance. Okay, know what those mean. There's an x-ray, another x-ray, CAT scans, ultrasound, and that's it. So we'll stop the recording.